Paranoid personality disorder represents one of the most challenging and misunderstood conditions within the spectrum of mental health disorders, affecting approximately 1 to 4% of the general population. This complex psychological condition is characterized by a pervasive pattern of distrust and suspiciousness of others, where individuals consistently interpret the motives of others as malevolent or threatening. Unlike temporary suspicions that might arise from specific circumstances, paranoid personality disorder involves deeply ingrained patterns of thinking that persist across various situations and relationships throughout an individual's life. The diagnostic criteria for paranoid personality disorder require the presence of at least 4 specific symptoms that begin by early adulthood and manifest across multiple contexts. These symptoms include persistent suspicions that others are exploiting, harming, or deceiving them without sufficient justification, preoccupation with unjustified doubts about the loyalty or trustworthiness of friends and associates, reluctance to confide in others due to unwarranted fear that information will be used maliciously against them, and the tendency to read hidden demeaning or threatening meanings into benign remarks or events. Additionally, individuals with this condition often bear persistent grudges, are unforgiving of perceived insults or slights, quickly react with anger or counterattack when they perceive attacks on their character or reputation, and harbor recurrent suspicions regarding the fidelity of their spouse or sexual partner without reasonable justification. The development of paranoid personality disorder appears to stem from a complex interplay of genetic, environmental, and psychological factors. Research suggests that individuals with a family history of schizophrenia or other psychotic disorders may have an increased risk of developing this condition, indicating a potential genetic component. Childhood experiences of trauma, abuse, or neglect can also contribute to the development of paranoid thinking patterns, as can growing up in environments characterized by hostility, criticism, or unpredictability. Some studies indicate that individuals who experienced early loss of a parent, severe childhood illness, or other significant stressors may be more vulnerable to developing this disorder. Living with paranoid personality disorder creates significant challenges in multiple areas of life, particularly in forming and maintaining interpersonal relationships. Individuals with this condition often struggle to establish trust with others, leading to social isolation and loneliness. Their constant vigilance and suspicion can be exhausting both for themselves and for those around them, creating a cycle of conflict and withdrawal that reinforces their paranoid beliefs. In romantic relationships, their unfounded jealousy and suspicions about infidelity can destroy partnerships and create ongoing turmoil. Professional relationships may also suffer as individuals with paranoid personality disorder may interpret constructive feedback as personal attacks or view workplace interactions through a lens of suspicion and mistrust. The impact of paranoid personality disorder extends beyond personal relationships to affect academic and professional achievement. Individuals with this condition may have difficulty accepting supervision or feedback from authority figures, leading to conflicts with teachers, supervisors, or colleagues. Their tendency to perceive criticism as persecution can result in frequent job changes, academic underachievement, or legal troubles. The constant state of hypervigilance and suspicion can also contribute to chronic stress, potentially leading to physical health problems and exacerbating mental health symptoms. Diagnosing paranoid personality disorder requires careful assessment by qualified mental health professionals, as the symptoms can overlap with other conditions such as delusional disorder, schizophrenia, or mood disorders with psychotic features. The diagnostic process typically involves comprehensive clinical interviews, psychological assessments, and careful observation of the individual's behavior patterns over time. Clinicians must differentiate between the persistent suspiciousness characteristic of paranoid personality disorder and the more severe delusions associated with psychotic disorders. Additionally, cultural factors must be considered, as certain behaviors that might appear paranoid in one cultural context may be appropriate responses to actual threats or discrimination in another.
Treatment of paranoid personality disorder presents unique challenges, as individuals with this condition often resist seeking help due to their inherent distrust of others, including mental health professionals. When treatment is pursued, It typically involves long-term psychotherapy focused on building trust in the therapeutic relationship and gradually challenging paranoid thought patterns. Cognitive behavioral therapy can be particularly effective in helping individuals identify and modify distorted thinking patterns, while psychodynamic therapy may help address underlying emotional conflicts and childhood experiences that contribute to paranoid beliefs. Building a therapeutic alliance with someone who has paranoid personality disorder requires exceptional patience, consistency, and transparency from the therapist. Treatment goals often focus on improving social functioning, reducing isolation, and developing more realistic interpretations of others' behavior rather than completely eliminating all suspicious thoughts. Group therapy can be beneficial for some individuals, as it provides opportunities to practice social skills and receive feedback from peers in a controlled environment. Family members and loved ones of individuals with paranoid personality disorder often experience significant stress and frustration in their relationships. They may feel constantly accused, mistrusted, or blamed for problems that seem to stem from misinterpretations or unfounded suspicions. Education about the condition can help family members understand that these behaviors are symptoms of a mental health disorder rather than personal attacks or character flaws. Family therapy or support groups can provide valuable strategies for maintaining relationships while setting appropriate boundaries. The prognosis for paranoid personality disorder varies significantly among individuals, with some experiencing gradual improvement over time while others maintain relatively stable symptoms throughout their lives. Early intervention and consistent treatment can lead to meaningful improvements in social functioning and quality of life. However, the chronic nature of personality disorders means that ongoing management and support are typically necessary for optimal outcomes. Research into paranoid personality disorder continues to evolve, with scientists investigating neurobiological factors, genetic predispositions, and environmental influences that contribute to its development. Advanced neuroimaging techniques have revealed differences in brain structure and function among individuals with paranoid personality disorder, particularly in areas associated with threat detection and social cognition. These findings offer hope for developing more targeted interventions and potentially preventive strategies. Prevention efforts focus on early identification and intervention, particularly in children and adolescents who may be showing early signs of paranoid thinking patterns. Creating supportive environments, addressing childhood trauma, and providing appropriate mental health resources can help prevent the development of more severe symptoms. School-based programs that promote healthy social relationships and teach coping skills may also play a role in prevention. Despite the challenges associated with paranoid personality disorder, many individuals with this condition can achieve meaningful improvements in their lives through appropriate treatment and support. With patience, understanding, and professional help, people with paranoid personality disorder can develop better relationships, improve their social functioning, and experience greater satisfaction in their personal and professional lives.